So today we are going to see about the development of internal jugular vein and external jugular vein. So if you see here veins of the head and neck, it develops only after the development of skull. First, initially the ventropharyngeal vein is formed. This ventropharyngeal vein opens into the tributary of face and tongue. So this tributary of face and tongue, the vein is called as a linguofacial vein. So at 8th week of one gestation, a large vein is formed. This large vein is called as a retromandibular vein. So this retromandibular vein it develops, it drains and venous blood from the temporal region into the linguofacial vein. Now the common trunk is established between the retromandibular vein and the linguofacial vein. This common trunk is formed by the vein called as a common facial vein. So this common facial vein is formed between the retromandibular and the linguofacial vein. This finally drains into the precardial vein which becomes the future internal jugular vein. So now coming to the external jugular vein, the terminal part of the common facial vein or the precardial vein, it communicates with the external jugular vein anteriorly. So this we call it as an anterior communication. Whereas if you see the retromandibular vein, it communicates with the external jugular vein posteriorly here, which forms the posterior communication. Later, the proximal part of the linguofacial vein, it becomes the facial vein. And then here you can see the posterior auricular vein, it opens into the posterior communication. Now the retromandibular vein, it divides into two, the posterior division and the anterior division. Now the posterior division of the retromandibular vein, it unites with the posterior auricular vein, which finally forms the external jugular vein. The external jugular vein finally drains into the subclavian vein. Here you can see the proximal part of an retromandibular vein unites with the facial vein and the common facial vein. Finally, it drains into the precardial vein and the precardial vein which finally forms the internal jugular vein. So this is the development of both the internal and the external jugular vein. Thank you.